Hello friends, how are you? I hope you all are good and doing well. In this video, I am going to discuss about the global health issues that is prevailing in our society for the very long time, and that is globally concerned, and that's why I thought I should discuss about that topic, and that topic is the HPV. That means a virus which is prevalent and carcinogenic. That means this HPV virus causes cancer in human being. So let us discuss this HPV and its vaccination programs and prevention from this virus. So let's start the video lecture. Myself Virendra Kumar, and you are watching Hirak IS YouTube channel. So what is our motive here is to educate the people, spread the awareness about this deadly virus HPV, and you know that already we have made the vaccines for this HPV causing virus, and vaccination drive has already started, but there is a need of spreading the awareness, disseminating the information regarding this HPV virus. So firstly we know about what is HPV. So HPV is a group of virus, about 200 virus collectively called HPV, and not all of them are so serious. Few of them are serious, and they are categorized into two groups: high risk HPV and low risk HPV. High risk HPV can cause cancers, but low risk HPV not necessarily cause cancer. So we will discuss the HPV virus causing cancer. So facts about HPV. HPV infection is very common, and it is stated that it is very difficult to avoid this virus infection who is active in the sexual activity, because mostly this HPV virus is transmitted through the sexual activity, and so that's why we can call that this is the sexually transmitted disease. HPV is a group of about 200 related viruses, and some of which are spread through vaginal, anal, mouth, and other contacts during the sexual activity. And HPV fall into two groups: high risk HPV and low risk HPV. High risk HPV causes cancer, and the cancers are of 6 types caused by the HPV virus. Those are oral cancer, penile cancer, vulva cancer, anal cancer, vaginal cancer, cervical cancer. These are the cancers caused by this HPV virus. So we'll study about this HPV virus which causes cancers, and how we can be well informed regarding this virus, and what are the steps are taken globally to prevent the people from such a cancer causing virus. and it is very difficult to avoid this infection if someone is sexually active. Around half of these infections are with a high risk HPV type. Most HPV infections go away on their own. If your immune system is strong, then your body immune system will remove such HPV infection by itself within 1 or 2 years. But high risk HPV infections that persist can cause cancer. Sometimes HPV infections are not successfully controlled by your body immune system, and thereafter they become cancerous. To prevent such a kind of infection, we must be aware. So let us explore the impact of HPV vaccine and how much the HPV vaccination is effective in preventing the HPV causing cancer. So I told you that there are 6 types of HPV cancers, and their names are generally related to the part of your body where the cancers are happened. If it is affecting the anal portion of your body, then it is called anal cancer. Similarly, cervical cancer, oral cancer, or throat cancer, penile cancer, and vaginal and vulva cancers. So out of these 6 cervical cancer we are going to discuss, and how it is serious and can be health hazardous. HPV causes an estimated 6,30,000 cancers worldwide each year, accounting for about 5% of all the cancers globally. So cervical cancer is the 4th most common cancer among women globally and caused an estimated 3,42,000 deaths in 2020, according to the WHO. So understanding HPV and its impact on cervical cancer. HPV and cervical cancer. HPV is a common sexually transmitted infection that can lead to a cervical cancer out of the 6 cancers. So, vaccines for the HPV virus has already been developed, since HPV is not a new thing. So, it has been prevalent among us as an infection from the very long time, and the vaccines has already been developed and vaccination drive has been carried out, and we had a good result after vaccination with this vaccine, and I would like to inform that 90% efficacy of this vaccine has been obtained. So let us see vaccine development of HPV vaccines commenced in the early 2000s. So HPV vaccines protect against the most common types of HPV. Global burden of cervical cancer. Cervical cancers statistic 4th most common cancer in women is globally is the cervical cancer. So it is most known cancer among the women, 4th most, right? After vaccination of the HPV, we can prevent up to 90% of the cervical cancer causes. So, benefit of HPV vaccinations, preventing cervical cancers. Detailing the advantage of HPV vaccination in reducing cervical cancer incidence and mortality. It reduces HPV infection rates. It is effective in lowering the prevalence of HPV infections, prevents precancerous lessens and decreases cervical cancer cases, significantly lowers cancer related deaths. So after the vaccination of this HPV vaccine, we are able to control this cancer causing virus spread, and we are able to now reduce the death of these people from this HPV virus. High efficacy in preventing HPV infection and related diseases based on clinical trials and real world data. So as I already told you that efficacy of this vaccine is very good, and up to 90% cases has been controlled from this vaccine. So it is a efficacy is very high, and reduction HPV prevalence post vaccination is significant, substantial. Now, global HPV vaccination policies overviews. So globally there are different policies nationwide. So there is existence of policy differences, and target age group is also different for the different nation. Funding mechanism in different delivering setting. So you know that this HPV vaccination is targeted for the lower age group and about 12 to 15 years, both boys and girls. Not only the girls or women are susceptible to this HPV virus, even the boys and male person is also vulnerable to against this HPV virus. So, and why we are targeting the lower age group? Why not going for the above 30-40 years of age? Since the vaccination is effective when the people or person is not exposed to the virus already. Since after adolescent, when person is exposed to the sexual activity, then there is already been chance that that person has been exposed to the HPV virus. So there, after the exposing of the HPV virus, the efficacy of this vaccine is not that much, and so if person can get vaccinated after 30-40 years of age, when there is a need, and that can be ascertained with the health provider. So it depends on the people. Addressing barriers in HPV vaccine uptakes. So we are here to form and aware the people, so that everyone be well informed and know that vaccination against this HPV virus is very important and can be cured with the advanced vaccination by time. So we are very much needed that if we are lacking the awareness, the vaccination drive will be not successful, and the reduction in the cancer cases will be hampered. So our motive should be to make the people aware about this vaccination, that HPV vaccine is available in the market, and health organization and should get vaccinated when the girl or boys are below 15 years of age. That will be most effective. So our motive here is to improve the education and information dissemination and the vaccination, and people are mostly hesitant to take the vaccine. So we should enhance the public trust through awareness campaigns, access issue, implement school-based vaccination programs, and improve healthcare provider recommendations. So if people are agreed to take vaccines, so vaccines should available to their doorstep and in their area, so that people can easily access the vaccines. So, future trends in HPV vaccination, exploring innovations shaping the future of HPV vaccination, new vaccine formulation, potential advancement in creating more effective vaccines. So, if present vaccine is of efficacy of about 90%, so our research R&D should be more to get the almost 100% efficacy and integration with the screening programs, so that to enhance the cervical cancer prevention by combining vaccinations with screening initiatives. So here important thing is that before some person is infected with the virus, and in the preliminary stages, if screening is done, then the cancerous stage can be prevented, and therefore the pre-cancerous stage detection diagnosis is very important. And if someone is having the symptoms like wart around the intimate area, mouth, so that person should get the diagnosis and screening, so that the serious infection can be avoided. Economic impact of HPV vaccination programs, analyzing the cost effectiveness and long-term benefits. Cost reduction from cancer treatment expenses. So if we promote the vaccination to the people in the large numbers, so we can avoid the cancerous stages among the peoples, and therefore we can reduce the cost of cancer treatment and on the large scale. So this should be very well steps if we can reach to the people for the HPV vaccinations in the effective manner, and certainly this will improve the health of the people. The vital role of healthcare providers in HPV vaccination. Sure, it is the healthcare provider who take the responsibility to make the people aware about this kind of virus, and they are the key in recommending and administering HPV vaccines. Building trust is important for increasing the vaccine uptake and crucial in addressing patient concerns. Understanding public attitudes toward HPV vaccinations. So we already know that people are very reluctant during the taking the vaccination, and whether it is HPV vaccination or other kind of vaccination. So our purpose should be to make the people aware, inform them, and if they have doubt, we should clarify their doubts, and so that we can convince for the vaccination, and only that then we will be able to overcome such type of cancerous disease. So there is a regional variations, influencing factors, role of education, campaigns. The public perception varies by region. So the people are of different mind and different thoughts region wise, and their perception may be different. Okay, so they can be convinced after educating them. Influencing factors like safety concern, religious beliefs, and media influence their perceptions. So people are concerned about the safety, that if they get vaccinated, whether they will have side effects or not, and sometimes it is also prevalent in the society that some religions prohibit the people, that people think that their religion is prohibiting to get vaccinated. So this is because of lack of the information and illiteracy. So we can educate the people effectively and convince them for the vaccination. So here the role of education and campaign is very important, and that is crucial in shaping the positive attitudes of the people. Yeah, so vaccine richness may vary region wise. some nation can have vaccine facility and others are striving for that. So variation in access based on the location and healthcare infrastructure. Socio-economic factors are there. Inequality in access influenced by the economic status. So people having the money can get the vaccine easily, and our motive, government motive, should be to provide the vaccines cost effectively, so that every netizens can get the vaccine in low cost, equity and HPV vaccine access. Addressing disparities and ensuring equitable distribution is important. So strategy for equity, utilizing targeted interventions, outreach programs and integration into immunization schedules should be. So successful implementation of HPV vaccination programs, highlighting impactful initiatives in HPV vaccination for cervical cancer prevention. First is the high vaccine coverage rates, leading to significant reduction in HPV related diseases. Effective comprehensive vaccination program illustrating success stories of successful prevention strategies. So I will discuss the case that the vaccination drive for the HPV virus is very successful and we are able to get the best results. So collaborative approach for effective HPV vaccination. Collaboration with governments, healthcare providers, NGOs and international organizations is essential for successful vaccination campaigns, and in partnership enhance vaccine accessibility and advocacy efforts critical for the program sustainability. Encourage policymakers, healthcare professionals and communities to prioritize HPV vaccination as a crucial preventive measures. Advocacy for vaccine acceptance, funding support and continued research is essential for achieving the widespread impact. Right. So if you want to spread the awareness and vaccination reach to the common people, we must work together in a collaborative manner, so that all kind of hindrances against the vaccination drive should be removed, and it will be easy to get the vaccine on time and to the targeted age groups. So friends, if you have any doubts regarding this HPV vaccination and any issues you have in your mind, please comment in the comment box and put your queries. We will try to give you the response regarding your queries. Don't hesitate to discuss the matter if you are suffering from any kind of infections. So it will be better to spread the awareness regarding this HPV virus. People hesitate to discuss these things in society and they become the sufferer. So we should avoid this kind of situation and should inform to our healthcare providers and get the screening on time, so that this deadly disease can be prevented. This is very dangerous disease. Once any person caught then that person's health may be compromised at a large extent, because cancer cure is very difficult, but we can prevent this cancerous disease by taking the vaccine on the time. So thanks for watching, and if you like this video, please press the like button, and if you are watching this YouTube channel for the first time, subscribe our Hirak IS YouTube channel, because your support is very important and this will motivate us to provide you the with the good knowledge informative video. So thank you friends, bye bye.